matariki te tipua, matariki te tawhito, kia tau mai te wairua, o ngā ira atua, kia tātou te ira tangata, tihei mauriora. Kei aku nui, kei aku rahi, nau mai, hare mai, ki ngā hurutanga o te Piki Oranga, kia mau mahara tātou, kia rātou ngā mate, o ngā huru ngā tau, kia koutou e rangi nui, e rangi. Kia koutou e rangi riri kohe. Ko Kere Opa Ratapu, ko Ella Ward, ko John Simmons, ko Aroha Bond. Anei rā mātou o koutou mahuetanga, e tangi nei, e mihi nei, e maumahara ki a koutou. Nō reira koutou ngā mate. Moe mai rā, moe mai rā, moe mai rā. Nō reira wai hō rātou te hunga mate ki a rātou. E huri mai ki a tātou ngā mahuetanga o rātou mā. Nau mai koutou ki te whakanui. Ngā tau e te kau o te Piki Oranga. Nō reira koutou nau mai, hara mai.
Te Piki Oranga was established on 1 July 2014, born from the realisation that health services needed to respond differently to the challenges facing Māori in Te Tauihu o Te Waka Māui.
Y275, I think, with the Waitangi Tribunal, showed really clearly the deficiencies in primary health care for Māori, and that we just don't get access, we don't get access to secondary care. There are a number of inequities within the health system. One of our key roles is to try and put us on a level playing field, make sure we get access to the care that everybody else enjoys, that we actually get better outcomes, health outcomes for Māori. That's our primary focus.
After 3 years of consultation with the Nelson Marlborough District Health Board and 7 Māori organisations, Te Piki Oranga was formed. The process of merging 6 Māori health providers was challenging, as Kaimahi operations and funding were transferred into a new organisation. Mata Waka, Whakatū Marae, Te Korowai Trust, Te Āmoa Health and Te Āwhina Marae housed and supported Kaimahi through the transition.
Being part of Te Piki Oranga from day one, the importance is ensuring that we can deliver services to our whānau that are needed, that we can wero ones like Te Whatuora to ensure that the contracts that we get, we are able to deliver to whānau appropriately, and it will never be enough, but it will at least give us the opportunity to work with them as best we can and support them in, if we don't have that service, to access others.
Te Piki Oranga founding directors and kai whakahaere stayed grounded by focusing on whānau Māori who needed the organisation to succeed. Te Piki Oranga began with a contract to provide whānau order services for personal health, mental health and addictions, tamariki ora and social work.
Whakatū Marae, of course, was one of the original shareholders and is still a shareholder in Te Piki Oranga, and had 2 health services that had been based here historically. So it was really an easy choice when we came to set up one site here in Whakatū for it to be at Whakatū Marae. And of course Whakatū Marae offered. So they've been a really driving force in Te Piki Oranga being where we are today. And we were based here and we actually only moved off because we grew too big and they also were growing. So there wasn't room for the both of us. But we had the understanding that if we could ever come back here, then that would be our first choice.
Te Piki Oranga began to build high-performing kaupapa Māori teams with tikanga and mātauranga woven through conventional healthcare practice. Tēnō rangatiratanga was fundamental from the start to enable self-reliance and independence among whānau Māori.
We are a kaupapa Māori organisation, therefore it means everything to us. But I think it particularly in health means able to do our own models, what we know works for our people and what our people are telling us they need. That's been, again, very important if we look at how we have fallen behind in a lot of the mainstream or accepted systems, so we need to do it differently. And that's what Tēnā Oranga Tēnatanga means to us, that self-determination to say, no, these are our models, this is how we want to do it, this is what works for us.
Te Piki Oranga was awarded an evergreen contract for whānau order in its third year, a first for any Māori health provider in Tito Ihu. The open-ended contract provided surety of funding that would catalyse sustainability and growth. New contracts for services were won, including smoke-free services, cancer screening, counselling and driver's licence support. With the police, Te Piki Oranga started Te Pai Oranga community panels, a restorative justice process that proves there are better places than courts for some people. With Te Ara Potama Corrections, Te Piki Oranga started providing tikanga Māori motivational programs to support offenders' rehabilitation. Te Piki Oranga developed a unique model of care, Te Puna Hauora, that places whānau at the centre. Diversification enabled Te Piki Oranga to act upon what was well known, that social factors determine intergenerational health and well-being, and that supporting access to cultural knowledge that unites whānau as Māori is key to the development of healthy, self-sufficient whānau.
Whānau are kept at the centre because they are the essence of the service. Our service delivery is solely for whānau and all that, what that encompasses. And in terms of the kaupapa, the tikanga that sits around it is what drives it and ensures that our whānau are well taken care of, that those rapport with whānau are developed with our kaimahi, and the āhuatanga of our kaimahi are extremely important in order to relate to whānau.
During our first decade, natural disasters racked the Tito Ihu rohi. The Kaikoura earthquake, cyclones, forest fires and floods saw Te Piki Oranga step up to provide manaki and support the emergency response. COVID-19 was a mixed blessing. Whānau suffered and still do, but it was also an opportunity to demonstrate resilience, flexibility and resourcefulness. By the end of its 6th year, Te Piki Oranga held 13 contracts with 5 organisations across the Motu. Soon afterwards, the region's first kaupapa Māori GP practice was opened. Manu Ora is a unique partnership between Te Piki Oranga and Nuku Health that does what other GP practices cannot.
Te Piki Oranga's success has been about collectivity. It's been about working for our whānau. It's about working from developing the kaupapa Māori model that actually our whānau can relate to and therefore are comfortable with our service and giving them better outcomes.
With growth came the need to recruit more qualified kaimahi and find space to expand. As kaimahi numbers grew, Te Piki Oranga reinforced its commitment to training a culturally competent workforce. A Pautaki position was established in 2015 to lead, build and tautoko tikanga and kaupapa Māori practice. The celebration of Matariki was firmly on the calendar years before Māori New Year was formally recognised. Te Piki Oranga has been celebrating this from almost the start.
We don't own Ngā Ora. I mean, they are part of tikanga and they are part of Mātauranga Māori, so they're not something that we own or are special to us. They are part of us and they're everywhere in our mahi. So this is actually who we are and what we do and how we do it. So those values are very important to us.
As it grew, Te Piki Oranga innovated, taking services into homes, marae and community venues, obtaining additional contracts for services such as Healthy Homes and Heartland Services in Waitohi Picton. Throughout, Te Piki Oranga has remained financially and operationally sound, fulfilling its obligations to funders, partners and shareholders. Toward its 10th anniversary, Te Piki Oranga stood its ground through the most extensive health sector reforms in 20 years. As it enters its 2nd decade, Te Piki Oranga maintains sight of its purpose, guided by the whānau for whom te kitenga and tauke whakatakanga are intended. Me whakahaumanu te mana o te whānau, a ka haere whakamua. Restore whānau health for a positive future. Mā te huruhuru ka rere te manu. Enable whānau to achieve wellness.
Nei te piki oranga, tiaki mai a whina mai te katoa. Mai ngā kaumātua ki ngā tamariki, awhie he mahi mo te piki oranga, awhie he mahi aroha. hauora, a fie kia